Welcome to Borno Health Update. My name is Ibrahim Amarawa. Health Update, as you are aware, is a program designed to update you on Governor Zulum's transformation drive in the healthcare sector under the stewardship of Professor Baba Malam Gana, the Commissioner of Health and Human Services, Borno State. Every 25th of April is set aside by the United Nations Health Assembly to raise awareness on malaria, which still remains a public health threat in our country. Delivering his address during this year's World Malaria Commemoration Day, Professor Baba Malam Gana reaffirmed the present administration's continuous investment in malaria prevention and treatment. As a result, Borno State is witnessing significant decline in malaria cases over the few years. He also applauded World Bank, WHO, and World Malaria Partners for their continuous support.
It is my singular honor and privilege to address you this morning as we mark the World Malaria Day, a day of reflection, a day of recommitment, and a day for renewed action. Malaria, as carefully enumerated by Permanent Secretary and the WHO representative of the state, has claimed many lives, especially among children and pregnant women, including lactating women. Yet our message this year is one of hope and action. End malaria with us, reinvest, reimagine, and reignite. We must reinvest in malaria because malaria kills so many lives, especially children under 5. As a matter of fact, about 4,000 children are dying in Nigeria every week. Yes, 4,000 children are dying in Nigeria every week from malaria. And that makes Nigeria as the highest in the world in terms of malaria burden and malaria death. There are over 80 countries in the world that malaria is present, but Nigeria is the global lead in this perspective. So we must reinvest in malaria prevention and treatment, prioritizing it in health budgets. Every investment secures our people's future. We must reimagine strategies through innovation, community ownership, and cross-sector integration, improved data systems, empowered communities, and better technology, which will enhance our efforts. We must reignite our passion, mobilizing health workers, community leaders, such as our district heads here present, who will carry on the message to the families and the youth. Our shared commitment is key towards fighting malaria. I'd like to express my deep appreciation to His Excellency, the Executive Governor of Borno State, Professor Babagana Umar Zulum, CON, MNI, FNSE, for strengthening our healthcare systems. Our government's achievements include including engaging an NGO for free malaria services in over 300 health facilities in the state. We've procured over 2 million doses of SCTs and RDTs, which are rapid diagnosis tests for malaria, implementing indoor residual spray IRS in over 1 million shelters within the state, protecting over 2 million children under 5 through seasonal malaria chemo prevention, which are an effort combined with our partners as elaborated earlier by WHO representative. Promotion of long-lasting insecticidal nets with over 150,000 distributed using healthcare facility routine approach, especially for pregnant women and children, was also carried out. Notably, between January to March 2024 and January to March 2025, we have seen a 39% increment in malaria testing using RDT and using microscopes within the state. We have distributed over the year some microscopes to some of our facilities. A 17% increment in treating with ACTs have been witnessed during this period. The partnership with World Bank Impact Project, Malaria Consortium, MSF France, WHO, NHED, and Mentor Initiative has driven progress in Borno State. We are scaling up integrated vector management, promoting long-lasting insecticide-treated nets, strengthening case management, and enhancing community engagement.
In his welcome address, the Permanent Secretary of the Ministry of Health, Dr. Shatima Maina Muhammad, highlighted the effects of malaria on our society and called for continued collaborative efforts to eradicate the disease.
My honor to welcome you all to this year's World Malaria Day. The World Organization has designated the 25th of April as World Malaria Day. This was done because of these dynamics and impact of malaria on the bills of the entire human race. According to records of the World Health Organization, in 2023, over 263 million people have been affected by the pandemic, and out of this, over 90% of the affected people of the cases are in Africa. And in Africa, 35% of these cases are reported to be in Nigeria. So this is a global call for action because of the desire to grow the morbidity and mortality associated with malaria. All hearts should be on deck to fight malaria so that we will have a healthy population and we contribute to nation building and development of our nation. So I would not like to this on this note. I would like to once again welcome everybody. I will also call the list, the presenters, the presentation, and everybody to cultivate his own better in the further pursuit of growth, health, and this lesson. Thank you very much. God bless you.
Addressing maternal mortality in post-insurgency period requires multifaceted approaches. In this context, a series of initiatives such as SEPA Bundle of Care Program and the Maternal Mortality Reduction Innovation Initiative were launched simultaneously in the state, aiming to reduce alarming rate of maternal and neonatal mortality. Following the implementation of these programs, intensive training sessions were conducted to familiarize nurses and midwives with the use of modern medical equipment in accordance with the SBBC protocols. Professor Baba Malam Gana, while addressing the trainees, urged them to pay close attention for the training and emphasized the ministry will reward those who excelled, but also issued stamina warning against unethical behavior, particularly in the labor room.
Nigeria contributes 30% of global maternal death. So every fourth woman you see in the world who dies from pregnancy is from Nigeria. And if you come to break down the statistics, Northeast and Northwest are the ones contributing to over nearly 55% of maternal deaths. In the Northeast, Borno is the largest. We have 13 local governments. MMC, Jere, Pondiga, Kaga, Mafa, Biu, Howard, Shahi, Dabua, okay, Manguno, Damasak, Mubio. These are all the programs which are where we have very high international. So you are doing a good job now, but you are here to train others. That culture will be brought. Even when I was a house officer, I worked in the labor ward over 35, 40 years ago. Even then, the attitude was not good. I'll give you one example. In England, a Nigerian nurse was checking the blood pressure of a woman, and then the telephone went off. He just answered the telephone. That woman made a complaint that because he was not focusing on the blood pressure, her blood pressure went up and her operation was cancelled. And she's made all arrangements before she came for the operation. That nurse was dismissed. She was dismissed and he lost his license in the UK. This is how practice is different. You must respect patients, you must give dignity, and you must pay attention. Especially when we're dealing with human life in the labor ward. Any slight mistake, either the woman dies or the baby dies. So we're trying to bring about a revolution where this is all going to change. And I'm expecting you to give the full energy and support. Inshallah, we're going to escalate this to other programs. So that, and this is the first state in Nigeria.
There's no place in Nigeria which has this equipment.
This is the first state.
Borno is the first.
So
They are making use of it.
I want you to be focused.
Make use of it. One of these was given to University Tomosa near Maiduguri. They were all fighting over it. What they had was just a small dolly bed. When they saw this, which can dry, I don't know whether it's dry,
Yes.
we took this to the first lady, who asked her to also stay. When the baby cried, she funny. It's like a rich baby. So we're changing. The healthcare system is changing. Seriously changing the state. We're doing reforms, and therefore we need you on board, all of you. Those who do well, we can can arrange to reward you in addition to whatever is.
Some of the trainers explain further the new techniques, the use of latest equipment, and the significance of such initiatives.
C is more about saving life of babies and mother during birth, trying to reduce the rate of maternal mortality in Borno State, which is being introduced to us, collaboration of the NCA with the Borno State government, LANDA, and the people from Tanzania, which came on board with the idea.
The training is all about SBBC, and the SBBC is a Safer Birth Bundle of Care. It was initiated from Tanzania. So we have a training with them in Gombe for 7 days, and then we are now retraining our other facility members that are here in the state specialists. Yes, the SBBC tools it comes in two. So we have the training tools and then the clinical tools. The clinical tools are the tools that we use basically on the live patients, but the training tools are the simulators. And these training tools include the Mama Bati, and then we have the Mama Natali, then we have the Mama U, we have the neonatal life, and then we have the basic neonatally. For the clinical tools, we have the penguin, and then we have the upright Professor Max, we have the neobit, and then we have the moyo. This penguin, we use this penguin for removing any mucus from the baby's mouth. When a baby is born, so there is discharge from the nose and then the mouth, so we use the penguin to remove all these discharges. And then the face mask, Baka mask, we use it for ventilation. Any baby that is not crying after birth, no breathing, no crying, so we use this face mask to ventilate oxygen so that the baby will cry. And then we say this is the moyo. We use this moyo before we use our peanut stethoscope to hear the fetal heart rate sound. So now the Tanzanian people brought a new apparatus for us. This is the moyo, and then we use this moyo to feel the fetal heart rate of the mother, so that we can rule out there is distress or any other thing from the mother. Then this is our neobit. After the baby is born, we have resuscitated the baby. We ventilated the baby using our upright. We keep the baby in a well ventilated place, so we continue monitoring the baby using the neobits. The impact is that we wanted to reduce the number of neonatal deaths and then maternal mortality that we are facing in these state specialists. So we're using all these clinical tools. We use the clinical tools and then the training tools. The training tools will make us more perfect, so that when we went to live babies, we know how we practice it and then take good care of our baby to reduce the numbers of neonatal death and then the maternal mortality.
The training is a new invention of training in order to prevent maternal mortality rate and then the fetal maternal mortality in the state. This is a new training for us. Before, I was even thinking yesterday that the day we started, I said maybe we have been losing some babies because of resuscitation. We have learned that now we can resuscitate the baby even without oxygen. We can resuscitate our baby even without oxygen. The main problem is to remove the mucus in the baby's mouth, in the airways, clear the airways, then we continue to ventilate, and then the baby will cry. What the baby needs is to give more air to the baby so that it will expand the lung and the baby will start breathing. But before, when the baby is not, when we deliver a baby and the baby is not breathing, we think the only solution is to give the baby oxygen directly. But now we are told that we can ventilate and the baby can cry on his own.
Before this training, immediately when the baby was born and is not crying, we used to hold the baby upside down like this and be slapping the back. But after this training, we have learned that we should use these tools. We should help our baby use these tools to stimulate the baby to cry. Ventilate We should check if there is any mucus. We'll use penguin to sanction it. Then we will use this upright back and marks to.
Some of the participants also applauded government's initiatives and promised to use the acquired knowledge for the purpose intended.
We have learned a lot. We have learned so many new things. And as they trained us about the new things, the old ones have gone, while we will now depend on the new things that we were taught. We are not so much conversant with the resuscitation of babies, with controlling bleeding, that is postpartum hemorrhage, when a woman delivers and she's bleeding profusely. We are taught how to control it. We are taught how to control, how to know the cause of the bleeding of this woman. So we'll try and see that we save her life. And the baby, we'll make sure, if it's a normal delivery, no problem. But when we see that our baby is limp, weak, does not cry, they have taught us how to resuscitate this baby.
We have learned a lot in this training. So the training is all about giving care to the women during deliveries. So we've learned from third stage of labor to bleeding after birth, uterus anatomy, and resuscitation of babies.
We have learned a lot in this workshop, because we have learned a lot pertaining how to take care of our mothers and our babies that are delivered, those that have problems immediately after delivery. And we can be able to resuscitate the baby perfectly, and so that the baby can be able to cry. Because any baby that is not crying at birth, we feel that the baby has a problem. So we now know how to resuscitate the baby very well, so that the baby can cry. And even the old type of model that we used before in resuscitating the baby, now we will no longer be using that one, since this one is a new initiative entirely. And even how to reduce maternal mortality as a result of excessive bleeding during delivery. We have been trained on how to give them a very, very comprehensive care immediately they deliver, so that there will be no any loss of life as a result of bleeding from a woman that has delivered.
Ala misali muka karba mace in ta sha ruwa yarinya baby idan ta dawo za mu ce a'a ku ne mana fe ku yi sauri ku tafi general. In ta sha ruwa baby in bata yi kuka ba. Yanzu a training nan gaskiya mun karu sosai, ko da a ce daɗin ma mu ma muna cire su numfashin, amma yanzu wannan training ya nuna mana no knowledge. Kafin da mu tura specialist din ma mu muna da kayan aiki, kuma muna da ilimin da muka karu da shi, ba sai mun tura ba. Za mu iya mu yi kokari mu ma mu cire har yaro ya samu numfashi har ya fara kuka.
Well, viewers, with this, we have come to the end of this week's edition of Borno Health Update. We hope you enjoy the program. Join us next week for another interesting segment. Until then, I am your host, Ibrahim Amara. Goodbye.